Hi, Dr. Masa at L.AC Chiropractic Clinic. Today's topic is frozen shoulder. Frozen shoulder is a condition characterized by stiffness and pain in your shoulder joint. Symptoms: frozen shoulder typically develop slowly and in 3 stages. Each stage can last a number of months. First stage is freezing stage. Any movement of your shoulder causes pain and your shoulder's range of motion starts to become limited. Second stage is frozen stage. Pain may begin and diminish during that stage. However, your shoulder becomes stiffer and using it becomes more difficult. Third stage is thawing stage. The range of motion in your shoulder begins to improve. For some people, the pain worsens at night, sometimes disrupting sleep. Causes: the bones, ligaments, and tendons that make up your shoulder joint are encased in a capsule of connective tissue. Frozen shoulder occurs when this capsule thickens and tightens around the shoulder joint, restricting its movement. Doctors aren't sure why this happened to some people, although it's more likely to occur in people who have diabetes or those who recently had to immobilize their shoulder for long periods, such as after surgery or an arm fracture. Risk factors. Certain factors may increase your risk of developing frozen shoulder. Age and sex. People 40 and older, particularly women, are more likely to have frozen shoulder. In Japan, because of the people in 40s and 50s have frozen shoulder, so therefore it's named 40s shoulder or 50s shoulder. And immobility or reduced mobility. Rotator cuff injury, broken arm, stroke, recovery from surgery are also risk factors. And systemic disease like diabetes, overactive thyroid, underactive thyroid, cardiovascular diseases, those are also risk factors. Treatment. Frozen shoulder generally get better over time, although it may take up to 3 years. The focus of treatment is to control pain and restore motion and strength through physical therapy. Standard medicine usually use 2 different kinds of treatment. First one is non-surgical treatment, such as non-steroid anti-inflammatory medicine. Drugs like aspirin and ibuprofen reduce pain and swelling. And steroid injections. Cortisol is a powerful anti-inflammatory medicine that is injected directly into your shoulder joint. And second treatment will be surgeries. However, those drugs and surgeries, of course, they have risks. Therefore, I highly recommend you should try acupuncture first, because acupuncture may help to reduce the pain and also relax the muscles and ligament. So it's a safe, effective, and cost-effective to control your pain and restore motion. First, we Japanese style acupuncturists check the pulse. 6-point, light touch, deep touch, compare and contrast, and face check, textured, moistured, color, and tongue, and also check the abdomen and back and decide what meridian channel is too much energy key and what meridian channel is too little energy key. So we have to enhance the meridians which is less key, and we have to control the meridians which has too much energy. So patient lay down like this, the affected side shoulder up for comfortable position. Needles are put into acupuncture points on neck areas and shoulder areas and arms, back and lower back area. Keep these conditions for 15 minutes to 20 minutes and let patient relax and let energy flows. When patient has too much pain, we have to put an electrical stimulation through the needles to control those severe pains. This is one example to increase the stimulation through the needles. We hook up the wires with Japanese style O-ring and put an electrical stimulation through the needles. This way, stimulation is still within comfort zone, but increase the stimulation, more easily control the pain. 20 minutes left, so let's take off those needles. The Japanese style acupuncture, we always put fingers by the needle. This way, skin is not pulled by needles. It's more comfortable for the patient because if we do, for example here, just hold the needles and pull, you will see the needle is pulling the skin. Take a look here. See that skin is pulled by needles. This is not comfortable for some patient. Therefore, we always put our finger by the needles and avoid the needle is pulling the skin. We do acupuncture treatment for whole person first, then affected or symptomized body part treatment. That is a Japanese style acupuncture, which is very gentle, safe, effective, and cost effective. I just told you that frozen shoulder will be takes up to 3 years, but some patient is more than that. But you don't want to. Acupuncture help to heal better, heal little quicker. Why don't you try Japanese style acupuncture? It's an easy way to control your pain and improve your mobilities and heal frozen shoulder better. Thank you for watching. Bye now.
Bye.